Hi there, my name is Stephen Beard and I'm one of the psychologists here at Children's Program. And I just want to take some time to talk to you about what to expect for your diagnostic evaluation. The question I often get from parents during initial consultations is, how do I talk to my child about this? And one of the conversations that I always have with children generally goes along these lines. I say something like, I'm a psychologist, which means I work with kids to better understand how your brain works. So we're going to do lots of different activities today. We might use iPads, we might be working on puzzles, we'll do some talking. Some of these activities you might think are really interesting, you might enjoy them. Some of these activities you might not like so much, you might think are kind of boring. That's okay, I get it. Hopefully, we only are spending about 5 or 10 minutes on any one of these specific activities before we can move on to something else. So the goal here is to learn about how your brain works. It's not about passing, right, or getting an A. That's not really something that happens here. The harder that you work and the more honest that we are together, the better we understand how your brain works. So come in ready to work, and if you have any questions, feel free to ask. We're happy to answer them. Evaluations here are customized to fit the individual, right? So they're going to differ a little bit from clinician to clinician, but in general, there's likely going to be a cognitive assessment portion. Cognitive assessment is more looking at general ability. Oftentimes it gives us an IQ score. That might be something you're already familiar with, but we're really looking at all those individual components of those cognitive skills. That could be your verbal reasoning, your nonverbal reasoning skills, how quickly you process information, working memory, and that's really valuable for us to just get kind of a general idea of how your child's brain works. More often than not, if it's an ADHD evaluation, say, we might also look into some executive functioning measures as well. If there are concerns for autism spectrum disorder, we might do some autism-specific measures. Or we might be doing something to look at learning difficulties and doing some academic achievement measures as well. Depending on what your concern is, we might be looking at different types of formats. This might be 1 3-hour session. This might be a couple sessions spread out over a few days. And that's something that's going to be important to speak with your clinician about. Regardless, we want you to arrive ahead, right? We want you to be prepared. So these evaluations are long. As I mentioned, they're usually about a 3-hour slot. So we ask that you come with snacks for your child to keep morale up. If there's a preferred beverage, water's great, but if there's something else that we need to use to sweeten the deal to make sure that kids are here and happy to work, great. And because it's Oregon and you never know what weather's going to be like, whether the heat's blasting or the AC is going, I also encourage having some sort of layer just to be as comfortable as possible in the testing room. As parents, we do ask that you are here for the entirety of that evaluation. Sometimes kiddos get anxious, sometimes kiddos don't really like what they're doing and they want to take a break, and there's nothing worse than going out to check with mom or dad and having nobody there. That tends to make the situation worse. So please, we ask that you're able to be here for that whole appointment. Sometimes we're able to check in with you and say, hey, things are going great, you can go get coffee, but be prepared to be here for the whole session. Oftentimes, clinicians also have rating scales that they'd like you to complete, and this is a really, really awesome time to get those done, rather than having to do it at home right before the feedback session. So please take that time and be with us here at the clinic. After the evaluation session, we always have a feedback appointment. Now, generally, we have this feedback appointment a few weeks after the evaluation so that we as providers are able to gather all the data together. Sometimes we have multiple clinicians involved in testing. Sometimes we have one of our technicians assisting with some portion, or we're tag teaming between psychologists, and so having that extra time is really helpful for us to look at the data, examine the data, and be able to provide appropriate recommendations for you. Usually those feedback sessions are virtual, so again, be on the lookout for those Zoom links. But the whole goal of that feedback appointment is to not just discuss the results of the evaluation and any possible diagnoses, but more importantly, to talk about the recommendations. What's next? That's really the whole reason we're doing this, right? How can we create a roadmap for you and for your family so that this feels like not only a worthwhile process, but so that you're able to hit the ground running for those next steps. So the recommendations in that evaluation feedback session are one of the most valuable pieces of the puzzle. So again, we'd love it if as many caregivers can be present as possible. So if there are multiple parents, great. We'd love it if you all can be present. If there are multiple households, we'd love it if someone from each household is able to be present to talk through things. And this is a time to ask questions too. So if you've had any questions brewing throughout the course of the evaluation that you haven't had a chance to ask, this is a great time to ask those questions. Many of the families I work with are taking notes during this time. If that works for you, great. But really, this is your time, right? This is your time and your resources that we're using, and we really want to make sure that it feels like you're getting what it is that you're hoping to get out of this process. So we want to make sure that you understand what to expect during that evaluation itself, and that you have that time to discuss any questions or thoughts that you have during that feedback. Can't wait to see you.